If you're struggling with infertility and you have endometriosis, or you're curious if maybe you have endometriosis, then today's video is for you. Hi everyone, I'm Marl Salerno, functional diagnostic nutrition practitioner of ReclaimOptimalHealth.com, where I help couples just like you resolve their infertility and get back to creating those families you so deeply desire. Before we get started, I invite you to follow me on Instagram. I'm on there pretty much daily posting functional fertility content just for you. And it's a wonderful opportunity for me to connect with you. You can direct message me, share your story with me. If you have any questions, I'm happy to answer them and to serve you. So you can find me there at Marl Salerno. And if you don't mind, it would mean the world to me if you would click on that subscribe link down below so that you get notifications every week when I post these functional fertility videos. Okay, so what is endometriosis? So endometriosis is basically when the endometrial tissue begins to grow outside of the uterus, which it's not supposed to do. And most commonly, it begins to grow on the ovaries, the fallopian tubes, the lining of the abdomen, the bladder, and the bowels. Now, endometriosis affects 1 in 10 women and generally around the ages of about 24 to 40 years old. Now, just like the endometrium that responds to hormonal fluctuations every month, where your endometrium thickens, getting ready for pregnancy, and if it doesn't happen, it then breaks down and then you bleed, right? And you have your period. Well, endometrial growths respond to those hormonal fluctuations as well. The difference is that your endometrium is able to get rid of the blood, right? You're able to get it out of your body. With endometrial growths, the blood actually gets trapped in these growths and it creates inflammation and swelling and pain and can result in a whole slew of symptoms as a result. So some of those symptoms might be heavy menstrual bleeding, irregular periods, painful periods, spotting or bleeding between periods, pain in the lower abdomen, pelvis, or low back, bloating and gas, constipation and diarrhea, nausea, fainting, lethargy, chronic fatigue, painful intercourse. Now, endometriosis may develop for a number of reasons. One of them may be genetic. It could be lifestyle factors, maybe food as well, like processed foods, too much sugar, a lack of exercise, for example. It could develop because of a congested liver and too much of the bad estrogen moving through the body, and you're not actually able to detoxify that estrogen properly because your liver is overtaxed and you're not detoxifying enough. We also know that endometriosis is associated with immune system dysregulation. So basically, your immune system is weak and it's associated with high amounts of inflammation. So how do we take care of that? Like, what do you do? So from a functional approach, how I look at this is I like to help support women boost their gut health, because we know that 80 to 90% of the immune system is produced in the gut. So if we're able to help your overall gut health, right, and use things like a probiotic that's designed for you, get your food right, rebuild the lining of your small intestine, things like that, then what we can do is actually boost your immune system. And then your immune system will go and target those endometrial growths and actually break them down and get rid of them itself. Isn't that cool? Now, the other aspect of this is the inflammation, right? So really reducing inflammation is key, like getting rid of the processed food and the sugar, and also identifying what foods you're sensitive to, removing any kind of gut infections that you've got or heavy metals. These would be all inflammatory factors or stressors that are increasing the chances of that endometrial growth existing. And then what I definitely like to do is to support the liver and help the liver learn to detoxify things well and get your bowels moving better, because we poop out all of our excess hormones. And so if your liver is overtaxed and you're not pooping enough, then all that bad estrogen is recycling in your body and contributing to those endometrial growths, which we don't want. So those would really be the three main ways that I would help you to improve your health and reduce the endometrial growths in your body so that you can fall pregnant naturally or have a successful IVF and really have your baby. So I hope this video was helpful for you all. I know how debilitating endometriosis can be. And please reach out to me if you have any questions. And I'll see you all again next time. Bye-bye.